Check your state and facility policy to make sure you are permitted to perform this procedure. Before you begin, perform hand hygiene and follow any other instructions provided in the preparation section of this program. To take a blood pressure, first check the patient's usual reading and determine the best site to use.
Feels okay?
For example, if she is receiving intravenous fluids in her left arm, use the right arm to take her blood pressure.
Let me take your book for a minute. I'm glad to give that back to you as we're through, okay?
Expose her upper arm fully by removing any clothing that's in the way. With the patient supine or seated, position her forearm at heart level and support it with her palm up. If the patient is seated, have her keep her feet flat on the floor. Make sure that you have the right size blood pressure cuff for the patient. The width of the cuff should be 40% of the circumference of the midpoint of the limb on which it will be used, and its bladder should encircle at least 80% of the upper arm. For a very large or obese patient, use a large adult cuff. Locate and feel for the brachial artery pulsation using 2 or 3 fingers, not your thumb. Once you've found it, place the bottom of the cuff 1 inch above the elbow, with the arrows on the cuff centered over the artery. If the cuff doesn't have arrows, estimate the center of the bladder and place that over the artery. Wrap the fully deflated cuff evenly and snugly around the upper arm. Position the manometer vertically at eye level and stand no more than 1 yard away from it. Place the stethoscope earpieces in your ears, following the angle of the ear canal. Make sure that the sounds are clear. After relocating the brachial artery, place the diaphragm of the stethoscope over it and hold the diaphragm in place with 2 or 3 fingers, not your thumb. Don't let the diaphragm touch the cuff or the patient's clothing. Make sure that the entire surface of the diaphragm touches her skin. Close the valve on the pressure bulb by turning it clockwise until it's tight. Do not over-tighten the valve. Then quickly inflate the cuff 30 millimeters of mercury above the patient's usual systolic pressure. Slowly release the valve on the pressure bulb and let the manometer needle fall 2 to 3 millimeters of mercury per second. Note the point on the manometer when you hear the first clear sound. This is the systolic pressure. The sound will slowly increase in intensity. Continue to deflate the cuff slowly, and when the sound disappears, note the pressure to the nearest 2 millimeters of mercury. This is the diastolic pressure. Listen for 10 to 20 millimeters of mercury after the last sound, and then let the remaining air escape quickly. If you need to recheck your results or are unsure of your reading, wait at least 30 seconds before taking the blood pressure again. Remove the cuff from the patient's arm. To complete the procedure, help the patient into a comfortable position and cover her upper arm again. For an adult, the normal systolic pressure is 100 to 140 millimeters of mercury, and the diastolic pressure is 60 to 90. For an older adult, the normal systolic pressure is 100 to 160 millimeters of mercury, and the diastolic pressure is 60 to 100. As part of your follow-up care, notify the charge nurse if the blood pressure reading is abnormal. Perform hand hygiene and report completion of the procedure and your observations to the charge nurse. See the follow-up section of this program for detailed information.